Okay, we're back. Our timer went off, and that tells us that our screens have incubated for 15 minutes. We're going to take those out of the incubator. Okay. Another thing to mention with PEG is you want to make sure that a gel has not formed, and these tubes look fine. We're going to put our tubes into the cell washer. Checking for gel in all of these.
You want to make sure that you keep your tubes in the same order that you took them out.
Okay. We have them balanced. We're going to close the lid. We're going to do 4 cycles because we tested in PEG and hit start. While that, we are not going to spin and read at 37 because that's not recommended for use with PEG. So if we were using another enhancement such as albumin or LIS, we would have to do a 37-degree reading prior to washing our cells. We're going to go right to the antiglobulin phase, and we have to wash before we do that. I just wanted to go back to the last patient that we had. I just wanted to show you what an Rh negative adult looked like. So this was the last of our patients that we had previously been working on. I wanted to show you the tubes. This is somebody who is B negative. So you can see the anti-A and anti-D are both negative. Anti-B is 4+. And your reverse cells. This is a 2+ reaction with the A1 cells, and the B cells were negative. So like I said before, you always want to record those reactions right away. So I had pre-recorded them, and I just saved these tubes just to show you. I'm going to throw those away. This last one, this is the results for the B negative. Okay. Now while we wait for the cell washer to finish, I guess I can just talk to you about reading. When these come out, we're going to add 2 drops of anti-IgG to each tube. Okay. Anytime you use anti-IgG, you must always wash first. The washing is to remove residual proteins. Okay, if you don't remove all that protein, it can neutralize the anti-IgG. So we're always going to wash first before we use IgG. The other thing to mention with anti-IgG is anytime you get a negative reaction with this, you always must confirm that your IgG has not been neutralized with check cells. Okay, check cells are like a built-in control to make sure that your IgG was added and is capable of reacting. So anytime you get negative at the IgG phase, we're going to then have to add 1 drop of check cells to each tube and spin and read and make sure your check cells must come up positive. If your check cells come up negative, then the test would be considered invalid and would have to be repeated.
So your check cells are red cells that are already coated with an antibody, and they're usually manufactured with an anti-D coated antibody on the red cells. That's what makes them a positive control if your anti-IgG has not been or is neutralized.
Okay. Another thing to mention is what we had demonstrated to you was adult testing. So we do forward and reverse. We do not do week D testing with our adults currently. Occasionally we'll do it if it's a special situation, but we don't routinely do week D testing on our adults. You'll see in a future video when we do neonatal testing, we perform week D testing if the immediate spin anti-D reaction is negative. Anything else you want to add?